So my presentation is really over applying a sustainability lens for leadership oversight. So majority of my job right now is really a clinical practice consultant, but I do a lot of advising for leadership and quality improvement. And so this is a really great opportunity for me to kind of showcase some of the work that I was working on for my organization of Kaiser Permanente in Northern California. I have no real perceived conflicts of interest or related to this presentation. And so some of the objectives I just want to talk to you about in this particular project is really just reviewing the importance of sustainability and the DMP focus, really walk through that organizational assessment that we saw and some of the barriers to sustainability. I'll talk about what the IHI sustainability framework is, and then also demonstrate how the nurse leaders, which is my population that I use for this particular quality improvement, how they applied this framework to really focus on mobility. So what is about sustainability? I think if everyone pull out their phone now and Google it, most likely you're gonna get something about climate change, someone talking about carbon neutral when they talk about sustainability. But in healthcare, it actually has a really great place and is actually a new field for us. And so I found this very fascinating. And I'll talk about why some of those interests really piqued with me, because as a nurse leader of ICU back in the day, that was just one of the things that we always used to talk about. All of these things about HAIs and harm, sentinel events, and things of that nature will happen in the unit. And then in another 2 or 3 years, they're reinvigorating the same thing. They're talking about the same bundle. They're talking about the same practice. And I'm like, this has to stop. Like, let's go back to our foundational things. Let's build infrastructure. So stumbling upon sustainability just really truly spoke to me as a nurse leader. So this is no surprise. During the pandemic, our focus was everywhere else, right? PPE, hand washing, social distancing, masks, things of that nature. So it really did put a damper on our practice and quality improvement, and we started to drift in a lot of different areas. For this particular project, we're really gonna be focusing on the leadership oversight, and I really just clear-cut it a little bit and talked about mobility. But really the importance of it, if we don't sustain what we put in place, we don't really have standard work, it really is going to affect our quality of our results. We're gonna have bad outcomes. It truly demotivates our staff and is wasteful. So we do really, really great job with designing and implementing and rolling out projects, but quite often we don't have any infrastructure of how to continue to sustain those efforts and actually build upon it and get better. And that's the whole science and the methodology around sustainability. So some of these concepts around sustainability really expanded around sustaining improvements. Like I said, if you Google it now, you'll probably get a whole bunch of different line items around that. Some people are starting to pull finance into it. But really for this one, we really focused on using it, and at least for me, I find it's most impactful for my practice, is really using it as a process for performance improvement and to really evaluate and provide those foundational structures to support that practice and keep it going. And so really, truly, I'm speaking to everyone in the room and on the audience virtually, is really to really look at sustainability and also the evidence-based practice and rigors around it, and really start to explore some of the components of process, the capacity, and the adaptability. And so this is a new area for us, and so I challenge all of us. I think anybody that's went through a DMP or master's program, they always have a little section cut out for sustainability in some kind of way, and you're like, what am I supposed to do with this? So I really do challenge you all, like when you're out there and you're talking about any line of work, how are you going to sustain this? Do you have the structure to keep this going? Do you have the right processes to make sure that your work, that all the work that you put into it is going to keep going, is going to continue to flourish? So once again, this DMP project, I really focused around our nurse leaders. And so nurse leaders, I was really looking at my managers, our assistant nurse managers, and also the director as well. But really what I wanted to do is just measure really around their sustainability adherences and just methodologies of what they'll be doing. And we'll talk about some of those behaviors. And then we talked about increasing their mobility performance, because that was something that they really needed to work on. So organizational assessment. Lots of things go into this, but one of the things I want to tell you is that I was actually a part of this team with the redesign. And so what we did in 2017, we noticed that our mobility scores were not really great. There was a lot of ambiguity around that, and so we really dived into the literature. We ended up using the Johns Hopkins highest level of mobility, which is like a 7-point scale of mobility. And a really great protocols. And so in 2018, we really adopted that, we redesigned it, and we spread that protocol in Northern California. And so during that time between 2018 and 2019, really great spread and hardwiring that was happening resulted in increased mobility, really, really great efforts. Here come 2020 knocking at our door and messed it up. All right. So with that being said, lots of changes in leadership priorities. And then we really started to see a decrease in everything and an increase in other things, right? So mobility decreased, falls went up, pressure injuries went up, CODIs, CLAPSI, everything else went sky high during that time. And so what we did is I put together a small team, and what we started to do is we actually did a COVID impact analysis and really started to look at our data outcomes. And so this was really an opportunity for leadership at our level, is to really to look across the board and say, how can we get back to refocus on some of these things that we're falling behind on? So during the SWOT analysis, that's no stranger to everyone in this room, but I think one of the biggest barriers that we were starting to see among everything, and I think this is everyday life outside of the pandemic, competing nursing priorities and then leadership engagement. And so a part of that, we'll just take a little quick snapshot. This was like the baseline data that we looked at in 2020. And so our target was 4.8 for mobility. I'll talk about that a little bit, but it's really the measurement, the way that we do it is the highest 2 bouts of the patient's attempt in the 24-hour period. But regionally, we're about 4.4, but this particular project site that I picked was even lower at 4. So they definitely needed some improvement in their mobility scores. So let's kind of switch gears, and I want to talk about that IHA. It was like, what is this sustainability framework from an Institute of Health Improvement? And so really is a really great guideline around management of daily activities within a unit to really maintain and monitor quality and staff engagement. And so I am a operational quality guy, so I really started to love driver diagrams. I don't know why. They speak to my soul. I just love the structure. I guess I'm a Navy vet, so I think that kind of comes from that too. But I really love this because it really centers in that the heart and soul around the unit. And that really that's where all of the work is happening. And if we don't have really great processes and monitoring engagement around that, we will have bad outcomes. And so this is really my theoretical framework for pushing that forward. And what I will tell you, I talked about earlier in the that we do a lot of great design and planning. And so quality improvement, we do really well about that. But it's something about this day-to-day operations that we truly think probably start to fall apart. Where we don't do that. And so really my project and my talking points was really focused around the secondary drivers of looking at standardization, accountability, visual management, problem solving, escalation, and then integration. So definitely we can't do anything without some type of survey, right? A pre and a post to something. So we really used the IHI, they actually have a facility assessment tool that's for sustainability. This is an awesome tool. It's very subjective depending on how you're using it, so I do want to just call that out. But I will tell you, in these different 17 different demonstrations, they really do walk you through supportive management, foolproofing your program. They talk about your feedback systems, the culture of improving systems, and then actually formal capacity building at the very end there. So really, really great tool. I use this for our pre and our post, and this is how I really monitor the nurse leaders' consensus of sustainability. So project. So I did a quality improvement, really used the model of improvement, PDSA cycle as well. So lots of great activities are happening here. So definitely when you're talking about a new concept of sustainability, most of the leaders, their eyes started to glaze over. So definitely had to really bring that down to a level where they would understand that and how they can truly operationalize it, which I thought that made this project very interesting. But we really did some educational sessions with them. Like I said, we did the survey. One thing about that survey that was really awesome, and it was something that we were able to really build upon with the leaders, is that a lot of quality improvement really does fall on the shoulders of nurse leaders, and sometimes they don't really have that skill set. And so really walking them through some PI methodologies like a Pareto analysis and truly helping them mathematically focus their efforts it paid so much great dividends with that particular piece. But so from that survey, there was a lot of turmoil during this time. And so I'm really proud of this project because there were just so many different variables, but we got through it. But what I will tell you is that they had 7 new assistant nurse managers come on board, and they were all travelers. So there was a lot of staffing challenges. Yes, a lot. It was a lot. And so there was a lot of turmoil, a lot of staffing issues, burnout, you say it happened. So I was dealing with a whole new set of people they threw on me on my project. So thank God that these were experienced people and they really had a heart and soul for mobility and truly understood that. So I took that and I ran with it. So what I did to try to really focus them in is using mechanisms that they already have in place, which are huddles and leader rounding. So that really became their interventions that I said, this is exactly what we want you to do every day consistently. You may not know all the policy and procedure, but being present on the unit and being the support for the staff goes a long way in keeping the data in front of the staff. And so that was really our interventions that we selected that truly drove the improvement efforts for the rest of the study here. So some of the outcomes here. So actually in this particular one, this is around the leadership adherence to sustainability and oversight. And so this one, like I said, we really focused on the huddles and leadership rounding. But I will tell you, these 2 categories that I picked out that we really focused on, huddling with your staff and actually using visual management, keeping data and opening up that dialogue with your staff, it really went a long way with them. And so you can see the delta here that majority of them actually did improve in their methodology of how they did that on a day-to-day practice. One actually did slip a little bit, the 12.5%, it did slip from the previous survey there, and it's really around process improvement and flow charts. So that one did slip a little bit, but overall it was very favorable. The limitation that I would say is the one thing I love about PDSA, because when you get to that A, you can adopt, adjust, or abandon, which is sometimes my favorite one. But I wasn't able to do that because I had new staff, and it was just so many different challenges. So I had to stick to that cycle and just keep repeating it and just reinforcing it. So that was a little bit of a limitation. And then for mobility, it really didn't hit the goal that I wanted it to, but it actually started to go up, which was really great. So as you can see, probably like in November and up to May, it was like 4.3, 3.8, and then it actually started to go up to 4.2. In July, they finally hit 5.8, so they actually started mobilizing even more. So the project actually did pay some great dividends in that particular piece. So for conclusions and implications, I would just tell you from a practice perspective, I really promote, people actually looking and using sustainability as a process to evaluate and improve a leadership oversight. There is a lot of great research that still needs to be done to identify a common definition of sustainability and how we can really use that in a validated way. Nursing definitely has a place at the table with this, and I think this is like my stickler. Leaders impact quality of care with systems thinking and direct oversight of nursing practice, and definitely there's policies to support this as well through safe patient handling and making sure that the nurses know that they're their coordinator of care. These are my references, and does anyone have any questions?